I want to take a moment on behalf of Commissioner Briones and all of our Precinct 4 staff to recognize a few of our special guests here that have joined us. Councilmember Ramirez, Julian Ramirez, thank you so much for being here. Kara Lambright, CEO of Herman Park Conservancy, thank you. And we have representatives from Councilmember Abby Kamen and Councilmember Sally Alcorn's office as well, so thank you. And if we could all take a moment to thank our law enforcement officers. We have representatives from Constable Precinct 5. Thank you so much for being here and for supporting us and for all that you do for our communities. Thank you. So thank you to all of you for taking time out of your evening to be here. Your voice is critical in everything that we are doing. As you know, Commissioner Briones led an effort at Commissioner's Court to make sure that we had more opportunities for community engagement, and that's exactly what we're doing here tonight. As a lawyer, as a judge, and as a mom, she is uniquely positioned to bring us together, to listen and to learn, and ultimately to help us get to yes. And anyone who works in Precinct 4 knows that we are tasked with getting to yes, and we wake up every day with the privilege to do that. And so on behalf of Commissioner Briones and our entire team, thank you. But with that, I will hand it off to my boss, Commissioner Lesley Briones.
Thank you so much, Erin, and I would also like to thank all of the Harris County Precinct 4 team members who are here. Can you please raise your hand? Thank you for your heart, hustle, and higher standards today and always. And to Councilmember Ramirez, thank you for always showing up and being such a leader. I appreciate you, and to the representatives from the other offices and Dr. Porsa and all of your team, I look forward to listening again to what you have to say. So there's so much I want to share, but we are here to hear from Harris Health, and I want to thank again the Herman Park Conservancy for their partnership and their leadership, and all of the Harris Health board members who are here. If you could please raise your hand so we can thank you. I deeply believe that the government needs to listen, and it needs to have an open mind as we work to serve the people who have given us this great opportunity to serve them and to deliver for them. And so at Commissioner's Court, it was incredibly important that we ask that we double down in community engagement across Harris County in partnership with Harris Health, with the Conservancy, to make sure that we were hearing the people's voice. And I want to thank the hundreds and hundreds of people who have shown up and who have called and who have reached out. So thank you. I believe in how do we get to yes, finding the win-wins, right? I'm a lawyer, I used to be a judge. How do we negotiate something where everyone wins? I love parks. I grew up within walking distance of a park. I have 3 little girls. We go to the park often. And what parks do for health is fundamentally important, especially in the city that we love so much. And we have a critical need. We cannot live without health. And what Harris Health does every day, and the excellence with which it does it, we are not only a safety net healthcare provider, but we are one of the best in the nation. And so I thank Harris Health and all of the leadership and staff for what they do every day. So I am extremely confident that with your partnership, with your ideas, we will find the win-win that our community needs and that our community deserves. We would love to share more about what we are doing with regard to health across Precinct 4 in Harris County, so we hope you'll join us at future town halls that Precinct 4 is hosting. You can get more information at the tables. But tonight, it is all about Harris Health and how we will thoughtfully, purposefully, and fairly expand Ben Taub Hospital thanks to the bond that the voters of Harris County approved. So without further ado, help me welcome our CEO of Harris Health, Dr. Porsa.
Thank you, Commissioner. You basically covered my presentation, but I'll give it a go as well. Y'all, good evening, everyone. Thank you all for being here. Before I get started, I'm going to apologize for those of you who have now heard this. I don't know how many times. I was actually looking today and counted the number of times I've done this, and this is occasion number 118. So over the last a few months, we have done this in different settings, different versions for 118 times, but who's counting, right? So if you've heard this already, I apologize. I'll try to mix it up and make it a little more interesting, but with that in mind, why don't we start with the video, if you will? It's just a 5-minute video. If you bear with me, we can get started.
Keep coming or patients keep walking in, who take care of them? We're over 100% capacity. For a hospital to be efficient, it should be around 85% capacity. That means that you have time in between one patient and the other to clean the bed, turn around the room, and do it in an efficient manner. When you're above 100% capacity, you start losing some of those efficiencies.
When the hospital's saturated, it affects the whole hospital. My day is about making sure that patients get their care and are running through the process of the hospitals. Hallway beds are when there's so much level of saturation, there's so much overcrowding, that in order to be safe for everybody, that we house somebody who needs to stay in the hospital in the hallway while awaiting a more permanent bed.
So that does mean that we have to treat patients sometimes in the hallway. It's not ideal for us. In the hallways, the noises are loud, the lights are bright, there's a lot of distractions going on, and that's not ideal for healing. We do risk the concern of patients having higher fall risk, patient safety incidents, but it does stretch our nursing staff and our techs and our physicians pretty thin because we're having to make so many accommodations.
For a given week, I would say at least 5 out of the 7 days we probably have patients that are in our hallway spaces. So when those individuals are in the hallway, it's challenging for them, but it's also challenging for all the other patients that are moving throughout the unit. We have to direct traffic different directions to be able to move patients fluidly without causing harm to the patient in the hallway, the patient that's in that bed that's being transported, as well as the team members that we have to take all into consideration.
It is always an honor and a privilege to take care of patients regardless of where they are. But it can be very challenging to provide the best compassionate care to patients who are stationed in the hallway. The patients are reluctant to share information that is vulnerable, that's sensitive, that they would usually want to share with their doctor. And so that just means that it takes longer to get the information, to get to the right diagnosis. It takes longer to actually get patients on the right treatment.
My son was having symptoms of a heart attack, and I said, we'll take you to Ben Taub. And he was there. He had to stay in the hall the whole time. You can't help but worry. I mean, for me, it was like, is my son going to be all right? Are they noticing him? There's no button. They don't have the order. Being in a room, you feel like, are they noticing? So it's very stressful to the family member or the patient.
Our patients here at Ben Taub usually do have family members with them because what families do is they not only are helpful for the patient, they're there for them to help reduce stress, to be there as a comfort system for the patient, but they also really help us. They're the ones that can advocate for their family members.
When the patients are unfortunately in the hallway, it really limits that volume of individuals who can be with their loved one at that given time, and typically that's one individual. It's very tight in terms of where the stretcher is in comparison to where the chair is in terms of the proximity of how much space the patient has.
Our utilization team looks at our bed and all of our resources in general to make sure that we're as sufficient as possible. Every day there are several huddles where the team gets together, looks at how many patients we have, how many beds we have available to ensure that we're using our beds in the optimal way for our patients.
Having 100 more beds could have made all the difference.
We are all trying to do the best that we can for our patients, but we need help in having a new facility to maintain all the goals and the metrics that we aim to achieve and to really be that safety net for the city of Houston.
At Ben Taub, we treat the entire Houston community. We treat patients regardless of their background, what walk of life they're from, and whether they have insurance or not. You know, medicine is about getting the right diagnosis and the right treatments, but it's also about this compassion, this kindness, this dignity that we're able to provide for the patients in our community.
I think about, like, we're at a point in history where we have to make the next step. This is just the way that the evolution of excellent systems happens.
100 additional beds for Ben Taub Hospital would mean that we would be able to fulfill our commitment to our community, that we will be able to meet the demands and take care of our patients and our community the best we can.
It's time for a better, bigger Ben Taub.
Thank you. Thank you. I don't know how many times I've watched this video, but still, every time the nurses talk about the fact that they need help, it really gets to me. And that's why we are here tonight. Let us get started. First and foremost, you know, what is Harris Health? Who is Harris Health? For those of you who may not be familiar with us, almost exactly 60 years ago, Harris Health was created through the vote of Harris County residents with a statutory mandate to take care of the indigent, the uninsured and underinsured. That's what created Harris Health, and we are proud of that mission. However, over the last 60 years, and as you heard from Commissioner Briones, Harris Health has become so much more to this community than just the largest safety net in Texas, fourth largest in the United States. Through our Level 1 Trauma Hospital, Ben Taub Hospital, Level 3 Trauma Hospital, LBJ Hospital, and 40 locations across Harris County, providing primary care, specialty services, chronic dialysis, dental services, outpatient oncology, outpatient surgery, and a whole host of other services. We, as you heard in the video, provide services to the entire Houston and Harris County community, and not just the indigent. Through our partnership with our medical schools, University of Houston McGovern Medical School, Baylor College of Medicine, and MD Anderson, Harris Health trains the future healthcare professionals for this community. According to the Texas Medical Board, almost half of all the doctors who currently practice in the city of Houston did their training at Harris Health, and that includes me. When I did my training 30 years ago at Harris Health, majority of it at LBJ Hospital. We are in partnership with more than 40 nursing schools. Every year we train thousands of LVNs and RNs. We have our own physical therapy residency program. We are the only hospital-based radiology tech program where we train radiology, ultrasound, CT, and MRI technicians, and a whole host of other training programs across Harris Health System. We are a major economic engine for Harris County. In 2022, we did an economic impact study, and we were able to show that for every dollar tax support that Harris Health receives, currently about a third of our revenue, we returned back to the county almost $6 in economic impact. In 2022, that amounted to $5 billion. With more than 10,000 employees, and in partnership, in collaboration, and in business with 400 plus small minority and women-owned businesses in Houston, 1 out of every 70 jobs in Harris County, either directly or indirectly, is related to Harris Health. And you already heard it from Commissioner Briones. This is probably what I'm most proud of, is our comparison to other hospitals in the United States, not just safety net hospitals, all hospitals in the United States. For a couple of years now, both of our hospitals have received magnet status for nursing. That is the highest honor you can receive as a hospital for the quality of the nursing services that you provide. Just a few months ago, Ben Taub Hospital became the first hospital in the Texas Medical Center. I'm going to say that again. First hospital in the Texas Medical Center to achieve magnet status for nursing with distinction. Only a handful of hospitals in the country have that accreditation, have that honor. LBJ Hospital, just a few months ago, became only the third hospital in Houston to achieve a letter grade A from Leapfrog that compares all hospitals in the country with regard to quality and patient safety. Everybody in this room knows of all the hospitals in Houston and Harris County. You all have seen the billboards, you all see the ads on TV, you all see the ads in the airport and along the highways. LBJ Hospital became the third hospital to receive a letter grade A. Only 3 hospitals in Houston, Texas have that distinction. So when I say we compare well to the rest of the hospitals in the country, I really mean it. So what is the situation today? As you heard on the video, almost all the time, 97% of the time, Ben Taub Hospital is in a saturation state. What does that mean? It means that every hospital bed inside Ben Taub Hospital is taken up by a patient. In our emergency room, in our observation area, in our inpatients. How does that translate to? It means that people who are coming to the emergency room are going to have to wait long hours before they can see a physician, sometimes more than 24 hours. It means that people who have been admitted to the hospital don't have a place to go to. We keep people on a stretcher inside the emergency room because there are no hospital beds inside the Ben Taub Hospital to assign a patient to. At some point, we have to create space in the emergency room so we can bring in more patients to the ER base so they can see the doctors. In those situations, we actually have to place patients in hospital beds in our hallways and corridors, which again, as you heard from our nurses on the video, this is not a dignified way. This is not a compassionate way to care for our patients, but we do it because we are the only public safety net hospital in the Texas Medical Center. We do not turn anybody away. We provide service for the entire community. So what is the current state? Ben Taub Hospital, with only 402 licensed beds, sees about 80,000 ER visits. That's a busy ER, y'all. And with more than 14,000 inpatient admissions. A couple of years ago, when we were looking into the future, we estimated that by 2030, we can anticipate at least another 18,000 ER visits, another 3,000 hospital admissions. These numbers are grossly underestimated because nobody a couple of years ago could have foreseen what happened last year in 2025 in this country with respect to the funding cuts to our healthcare infrastructure. $1 billion cut to Medicaid across the country, $800 million cut to the state of Texas disproportionate share hospital funding, which includes Ben Taub and LBJ, and everything that is happening with the Affordable Care Act. We anticipate that as high as the need is for our services, that need is only going to grow exponentially in the coming months. So these numbers are highly underestimated. So we have an urgent public health necessity in terms of capacity issue at Ben Taub Hospital that has to be addressed. The expansion of Ben Taub Hospital, again, as you heard from Commissioner Briones, as you heard on the video, fulfills the promise that we made to the residents of Harris County, where in November of 2023, overwhelmingly supported a $2.5 billion bond that has allowed us to establish our master facilities plan, the strategic facilities plan, which includes $400 million toward the expansion of Ben Taub Hospital, adding those 100 additional beds. So that is the plan. Create an expansion facility that can add up to 100 inpatient beds and some procedure areas to the existing Ben Taub Hospital. What that means is that Ben Taub will continue to be able to provide the services that this community needs. When people are brought up to Ben Taub hospitals and ambulances, their lives literally hang in the balance. This effort will literally save thousands of lives, of Houstonian lives, in the coming years. In addition to that, it will allow us to reduce the time that people have to wait in the emergency room and also hopefully reduce, if not eliminate, the use of hallway beds. So where can this expansion go? This has been a topic of a lot of conversation. We have studied this backwards, forwards, up and down, and there's just no two ways about it. We cannot build on top of Ben Taub Hospital. When Ben Taub was created 35, 40 years ago when it was being designed, it was not designed in a way to allow for it to expand vertically. Nothing about Ben Taub Hospital is foundation, is infrastructure, is life safety features, medical gases, plumbing, sewer, elevators, you name it. Nothing at Ben Taub Hospital was built in a way to allow for vertical expansion. We cannot build on top of Ben Taub Hospital. Ben Taub Hospital is landlocked. There is not enough space on the current footprint of Ben Taub Hospital to allow for an expansion facility that makes sense, that is fiscally responsible and operationally feasible approach to create an expansion facility. Create an expansion facility in a place that is geographically distant to Ben Taub Hospital also is not a feasible option because it does not address the capacity issue at Ben Taub Hospital, number one. And number two, if this facility is created somewhere else that is distant from Ben Taub Hospital, it would have to recreate all the support services and all the staff that Ben Taub has to offer. We would basically have to create a new hospital. We have $400 million, $410 million to create an expansion facility. If we were to do this, we're talking about a couple of $2 billion that we don't have at this point. So we cannot build on top of Ben Taub Hospital. We cannot build on the existing footprint of Ben Taub Hospital. We cannot create this expansion facility somewhere distant to Ben Taub Hospital. The only option available to us that is feasible and is prudent use of the taxpayers' money is to create this capacity at the land that is adjacent to Ben Taub Hospital. This won't work here. There you go. The land that is literally across the Ben Taub Hospital and immediately in front of the emergency room entrance to Ben Taub Hospital. This is the piece of land that we're talking about. Why is this the only option available to us? Is because when we build this capacity, this additional facility, it is close enough to Ben Taub Hospital that we can actually attach it to the hospital through a sky bridge, making it part of Ben Taub Hospital. So we can operate under the same level 1 trauma designation, under the same hospital license, completely eliminating the need to create all the support services that the Ben Taub has to offer, including emergency room, operating room, pharmacy, laboratory, radiology, cafeteria, parking, you name it. This becomes part of Ben Taub Hospital. Here's another version of the same map taken from Herman Park Conservancy. Here's the land that we're talking about. Here's Ben Taub Hospital and the proximity to Ben Taub Hospital that makes this the only ideal, the only feasible, the only prudent option for the creation of this expansion facility. What is eminent domain? Eminent domain is the power that has been given to governmental entities such as Harris County Hospital District, now Harris Health, to purchase land towards a public necessity, which in this case is the expansion of Ben Taub Hospital. That's what eminent domain is. Two things really important. There has to be a public need, a public benefit, and number two, it has to be purchased. There has to be a fair market value payment toward the owner of the land, which at this point is the city of Houston. So what has happened so far, and the reason we are here tonight, at the end of September, Harris Health Board of Trustees, and I apologize, I failed to mention that one of our board members is here, Dr. Hooley, appointee of Commissioner Briones. I apologize for not recognizing you. Thank you for being here tonight. Yeah, thank you. Thank you for that. Thank you for the recognition. After our Board of Trustees unanimously approved the resolution allowing me to go to the Commissioner's Court to ask for the condemnation of the land and procedure of the eminent domain, Commissioner's Court asked that we hold at least 4 additional town hall meetings, this being the 4th one, and also ongoing meetings with Herman Park Conservancy, which we have done over the last several months. And also want to thank Herman Park Conservancy leadership and their board for their collaboration and partnership with us. At this point, I'm supposed to return back to Commissioner's Court on January 29th for an update of everything that has happened since the end of October. And that meeting on January 29th, Commissioner's Court are going to set a date for a public hearing, which currently we believe is going to be March 19th. It is on that day at the public hearing where the commissioners actually get to vote up or down to approve the eminent domain procedure so that Harris Health can purchase this piece of land from City of Houston. Very quickly, and you all can see actually on the map under the pictures around the room, again, this is the piece of land that we're talking about, 8.9 acres of land that is owned by the City of Houston. It is managed by Herman Park. It is part of Herman Park, but separated from the park, which is up here, the zoo, and the golf course by Cambridge Street and South Braeswood Boulevard. Again, this land is immediately across the street, Lamar Fleming, from Ben Taub Hospital and immediately across the entrance to the emergency room, making it the ideal location for this expansion facility. This land in no way impacts any of the amenities and attractions of Herman Park. It does not impact the golf course. It does not impact the zoo. I want to be very clear about that. Again, this is where the land is and its proximity to Ben Taub Hospital. Here's the entrance to the emergency room. So we can literally create an expansion facility here, attach it to Ben Taub Hospital through a sky bridge, making it part of Ben Taub Hospital so it can operate under the same license and level 1 trauma designation. Here's the land that we're talking about that the media has referred to as the Wernicke track. Here's the Herman Park attraction. Here's the land in its current state versus the Herman Park attraction. And here's another picture of the land that we're talking about versus the Herman Park attraction. Just trying to delineate exactly what this land is and what it is not. So what we have committed to so far, we have committed to designing very thoughtfully and strategically so that this expansion facility can serve the needs of Houstonians now and the years to come, and also become an integral part of a future Ben Taub Hospital. We also know that this land is in the floodplain. We are going to do everything reasonable to put in place flood mitigation efforts, so by the time that this is all said and done, God willing, we get to actually create this expansion facility, this area is going to be actually more resistant to flooding than it is today. So it is not going to actually harm the flooding. It is actually going to be helpful to the flooding situation currently. We have already committed to creating a healing garden. We have committed to creating walking paths so that people who are trying to access Herman Park, the zoo, and the golf course through this area, they're going to be able to do it safer and more conveniently. And we have committed to continue working with the City of Houston and Herman Park Conservancy so we can become part of the solution to the parking challenge that Herman Park, the zoo, and the golf course have had for decades. So benefits of this plan. It allows Ben Taub to continue to operate uninterrupted while the construction is going on. It allows Ben Taub to remain in the Texas Medical Center, making it available to it and to its patients everything that Texas Medical Center has to offer in terms of education, training, and research. And it would improve hospitals' ability to continue serving this community, again, today and for the years to come. Main points: this proposed expansion project on the land that we just talked about allows us to address a public health necessity, which is urgent, soon to become emergent. And acquisition of this land adjacent to the Ben Taub Hospital and directly in front of the entrance to Ben Taub Hospital is the only fiscally responsible, operationally viable, prudent way of addressing this challenge. This is a shortened list of the community stakeholders and individuals that have so far provided us with a letter of support for this expansion project. And I'm going to stop here and thank you guys for being here again, and we can open to questions and answers. Thank you all again for being here.
Well, unless there's another mic. But good evening. My name is Brian McLeod. I'm the Administrative Director of Harris Health.
Sorry. I'm going to interrupt you.
Okay.
Before you do this, if I could have a moment and introduce Beth Robertson, who is the chair of our Harris Health Strategic Fund. Ms. Robertson, if you want to say a few words before we get started.
Sorry, Ryan, I interrupted you.
It's okay, go ahead.
Hello. This is my fourth town meeting that we've had, and I really am more and more connected to it. And I can tell you that I am a park person too, and I know my friends are here on this thing, and they're very surprised that I'm standing here talking about the hospital. They're giggling right now. But I'm here because I know this safety net, the hospital, the Harris Health that we've had, and it is imperative that we fix and expand Ben Taub. We're building a new LBJ now, but this is the only place to do it. You know, Herman Health has been a big part of my family's life, from my parents, my grandparents. We have been in every upgrade that Herman Park has done. We've done the zoo. We haven't done the golf course, I don't think. But anyways, Jim Crane's going to work on that. But I'm telling you that this is something that we as Houstonians can do, because we can do what Herman Park wants to do with is more parking. So I'm hoping that Harris Health and the Conservancy can get together and we can work on this together. That is the biggest problem that you guys have. And I am definitely for Harris Health. And Ben Taub is important, but I can tell you as important is what this group, Dr. Porsa and his team are doing. And I used to run the Cullen Trust for Healthcare for 35 years, and we did community health. And I learned how important a hospital district is. And this group is really ready to do everything and change the way we do medicine and help in our primary units. We have $500 million to add to the community primary care groups, and really, so people don't have to have diabetes. They can learn how to keep this for themselves. This is the one thing, by the way, I agree with our silly Secretary of Health in Washington, is we do too much junk and sugars. We should not be doing that. So we're gonna take that on. But what we have now in Houston, and he referenced this a little bit, we are #1 in uninsured, unfortunately. But I think with this group and what we're going to do, both mainly in the primary care, we are going to go to #1 in public health. This group is different than my 35 years that I have done this. This is why I am chairing the Harris Health Strategic Fund that raises private dollars to help match our bonds. Really, I want y'all to come together, my park friends, and think about this, because this we can do together, and we can have both. We are Houston, and we should do both.
Thank you, Beth.
That was a good use of my time. Welcome again, everybody. My name is Brian McLeod. I'm the Administrative Director of Communications at Harris Health, and I'm going to be facilitating the Q&A portion for tonight's town hall. I want to thank everybody who has already submitted their questions in the baskets at the front on the way in. If you are developing a question and you want to turn it in, we have a team that is circulating. You see Nicole here and Victoria over there. So just raise your card up and they'll come by and pick it up and put it in the basket. We're doing things a little bit differently than previous town halls tonight. We're going to start with open mic questions. So we're going to cycle through 2 open mic questions and then answer some of the written ones that we've received. So with that, we encourage you to keep your questions brief so we can get to as many of them as possible. But we can get things started off. The Precinct 4 team has graciously agreed to circulate with mics. So if you have a verbal question you'd like to ask to kick things off, ma'am, here in the yellow.
Good evening. My name is Tamara Bell, and I have a question. Dr. Portia, you've mentioned about how the inability to go above the current Ben Taub Hospital or the garage but you haven't mentioned the old Ben Taub, which is still standing. The first floor you all use for pharmacy, and I think the fifth floor is when you all can't release. It's 1502, you have 1502 and 1504 Ben Taub. You haven't mentioned that structure at all. So why can't you all use that site right there?
Yeah, I'm not sure what structure you're referring to as far as the old Ben Taub, but if that structure, that property that you're talking about, if it's in a geographically distant location to Ben Taub Hospital, it falls under the category of having to recreate another hospital, which we currently do not have the funding for. It doesn't matter if it's in the Texas Medical Center, North Harris County, South Harris County, East, West, it doesn't matter. If it's in a geographically distant location to current Ben Taub Hospital, creating an expansion facility anywhere that is geographically distant, not attached to the existing Ben Taub Hospital, would require us to build a new hospital, which we do not have the funding for.
That's okay, I deal with it on TV. Thank you so much.
Thank you. Tess.
Ma'am,
Hi, my name is Claire Caudill. I've been involved in parks in Houston for about 35 years. And I do want to say that Beth's family has really committed more than almost anybody else to the parks in Houston, and I appreciate their devotion and their devotion to health too. But I was trained by a lady named Terry Hershey, who said, nobody comes in and takes a park all at once. They just nibble it to death. And this is a pretty sizable nibble. And I think that if it is the only piece of property around, which I have questions about, but I won't get into, that maybe the city or the county should commit to a no net loss of parkland, so that if you're going to take 9 acres of parkland for Harris Health, then you need to find 9 acres of more parkland in the general area so that we don't lose parkland, because once parkland has something built on it, it is forever lost, and we will never get it back.
Thank you for that comment. I was like in 100% agreement with you until towards the end. So first and foremost, amen to what you just said as far as replacing the 9 acres. Forget replacing it acre by acre. There are hundreds of acres of land across Harris County that can be used to expand park spaces in Harris County. I absolutely agree with you. The part that I'm not sure I agree with you completely is the general area comment. There are areas of Harris County just similar to food deserts, just similar to health deserts. There are areas of Harris County, hundreds of thousands of Houstonians, who have no access to green spaces, to parkland. I absolutely endorse what you said about the city and the county doing better in terms of not just replacing this piece of land, but actually expanding on it. There is no reason why we cannot have 9 acres plus of land across Harris County to turn into green space. There is no reason for that, and we should do that, so I agree with you. Yeah, go ahead.
well, I need this one. Thank you. So we're going to continue to cycle through 2 spoken asked questions and then get to some of the written ones. So the first question we got here, Dr. Poor says, why can't you build vertically? I think you addressed this in your presentation, but I see old historic building renovated and expanded all the time. Why can't you do the same at Ben Taub?
Yeah, thank you for that. That comes out as well. Actually, the last, and I'm going to allow Louis to also chime in here in a minute. Last week, when we were having at the, we were at the Herman Park at the town hall, somebody made the same comment that, if I'm not mistaken, she said that she had just returned from Chicago, and she knows that they had built on top of an old museum, post office, department store, something else. And she just listed a whole bunch of different things, but none of them are hospitals. Y'all, I think perhaps after a nuclear reactor, there is no industry that is more regulated than healthcare and hospitals. So building on top of a hospital is not the same thing as building on top of a department store or a museum or whatever. We have studied this more than once, more than twice. You know, people have told me, Dr. Porsa, you are taking this land because it's the easiest path. My Lord, if this is easy, I don't ever want to do hard. This has been the hardest thing I've ever had to do, but we are doing it, again, not because we can. We're doing it because we have to, because this presents the only prudent, feasible option for the use of taxpayers' money to create this expansion facility today, but also allowing us, if we do this right, if we do this thoughtfully and strategically, we can use this $400 million as the foundation of a future, bigger, better, more capable Ben Taub Hospital. That's the opportunity that we have today in front of us, and I pray to God that we can take advantage of this opportunity and do it right. I don't know if Lewis, you want to add anything.
I think the only thing I would add, and I'm Lewis Smith, I'm the System Chief Operating Officer for Harris Health. I think I would just echo the fact that if you look at the state of Texas administrative code, you can easily Google it online. You'll see a myriad of expectations and requirements on healthcare facilities. When you look at the Joint Commission, they're an accreditation body. There are just significant requirements of a healthcare facility, a hospital occupancy that is significantly above business occupancy. And also, when you look at the Ben Taub complex, which today has 3 operating facilities in addition to the Ben Taub garage, you have the inpatient occupancy hospital building on the corner with the ambulance entrance. The building in the middle is our Ben Taub Towers. That is ambulatory clinics. That is business occupancy. And then the Neuropsychiatric Center, MPC building, which is also business occupancy related to that. You really cannot convert business occupancy to today's code of hospital occupancy, which is what would be required to do, related to that. And so you're left to the hospital that exists. And as Dr. Porsa said, it was not built to go up any higher than what it exists. And if you, one of the suggestions we had at another meeting was, we'll just build up alongside it, cantilever over it, and then go up. In a hospital occupancy facility, you'd have to shut Ben Taub Hospital down. You cannot do that with the risk and all the safety issues involved with that type of construction. You would also have to have the land to be able to go up. When the Ben Taub complex exists, it literally is on the property lines of what exists for Ben Taub. The other areas around it are either parkland, the cabin property in front, or the land that we're talking about here on the street, or you've got Baylor College of Medicine behind us with occupied buildings, et cetera, related to that. So you're literally dealing with a very compressed site of a hospital, and the ability to build on the existing footprint does not exist, and there's a myriad of reasons why that could not exist. Yes, you could technically build a building, but it would not be a hospital occupancy rated building to code related to that. The only option we have to keep Ben Taub open, functioning, and available for Harris County is to then build alongside Ben Taub Hospital on the property we're talking about. And that has been multiple iterations of reviews that we have ended up in that scenario after exhausting the other opportunities of trying to figure out how to not end up in that spot.
Louis, you want to mention something about the fact that if we could, I know we can't, but if we could even to build on top of Ben Taub Hospital, what that would have meant to the rest of Ben Taub Hospital in terms of bringing it up to code, because it was grandfathered.
Yeah, so anytime you build a facility, as you know, you build it to the codes that exist at that time, and you're grandfathered in to, as the codes change over time, unless you go in and construct within that space. Once you start touching that space again, you have to bring the area you are touching up to current code. Ben Taub Hospital today is still a multi-room patient structure with quad rooms and dual occupancy rooms. So there are some private rooms, but we still have that. Well, bringing those areas up to code, everything becomes single occupancy. So now Ben Taub is losing occupancy, trying to gain occupancy. So it's actually compounding the problem to make it worse, given the challenges that we have to Ben Taub. And to go back to the prior question, just about parkland and stuff, and I'm not saying this is parkland, but I do want to talk about, because we're very proud of our LBJ project. And for the first time in that area, we are going to be building onto the campus of the LBJ facility, that campus with that new inpatient hospital and a lot of things. We're building over an acre-and-a-half farm. We've got an orchard that's over an acre-and-a-half with walking trails. We've got a garden area that's going to be on the corner of Kelly and Lockwood. We are working to see how we are a part of the community. And in that area, they're going to be having some land and access to green space that they've never had access before. And that was not a requirement. That was not under permit requirements. That was Harris Health being a good neighbor within that community and getting a feedback from the community about what they wanted. And one of those was green space and the ability to have that within their immediate area, which we are providing. We're very proud of that as part of that project, and we're excited about what potentially we could do with this property in addition to the expansion facility for Ben Taub. We think there are opportunities of how we work with, as you saw on the slide, the healing garden, trails around that, related to really refurbishing some of that area for some enhanced green space in that area to the extent we can as we look at over time in the use of that acreage.
Thank you, Louis. We're going to have one more written question, then we'll be coming back to the audience. Why can't you tear down the parking garage and build your expansion facility there?
That's interesting. You know, it's actually worth mentioning. Everybody's talking about the issue with parking for Herman Park, the zoo, and the golf course. The fact of the matter is that Harris Health struggles with parking as well. And this has actually come up in the previous town hall meetings. Even today, despite the fact that Ben Taub Garage has, 2,500 spaces, I think, something around that number. We are actually renting parking spaces from TMC at the tune of $3 million a year to allow our own employees to park. So we don't have enough parking spaces today. So to say that we're going to knock down the only parking garage that serves our employees, medical staff, and our patients, I'm not sure exactly where the patients and our employees and medical staff would park, number one. And if I'm not mistaken, that entire garage is about 1.5, 2 acres. I have no idea. It's around a couple of acres. That is not enough to allow for an expansion facility to be created in a way that makes sense. And also then we will have to talk about how to attach it to the inpatient Ben Taub Hospital. The Ben Taub Garage is at the other end of our facility where we have the neuropsychiatric center and the outpatient facility. So I appreciate the idea of knocking down the only garage that serves Ben Taub Hospital, but I would not consider that a viable, prudent option to address the issue that we're trying to address.
From the audience, this gentleman back here.
Hi, my name is Patrick Forciori. I have a question about another possibility, and that's this. Ben Taub does not exist on an island in the medical center. You have all these other medical systems, hospital systems that are there in the system. Have you spoken with these other systems and asked them to pick up 5, 10 beds at their locations to alleviate some of this. Have you put a commission together to get a coalition of these hospitals to help to come together to deal with the public entity, the public having to deal with the service system public? That seemed like to be the very first thing that you would do, was to talk to these other entities that you are neighbors with to help relieve some of this pressure. Because once you build this new facility, in 10, 15 years, you will be at capacity again. Will your progress report to Commissioner's Court also include statements from these other hospital systems that they are not or will not be able to help accommodate for these additional beds that you are requesting? And if not, I would like to see that in front of Commissioner's Court, that you speak with these other hospital systems and put them at the table to say, we need help in this, because if you don't need that help now, and which you do, you will need that help 10, 15 years down the line. So I'm asking, why is that commission and why is that coalition not been put together?
Yeah, thank you for that question. So that need that you're talking about is not 10, 15 years from now. That need is actually 10, 15 years ago and has continued. So today, Harris Health is renting bed spaces from other hospitals, including St. Joseph and other hospitals. So that is happening today. So what you're describing has been happening. We have never had enough capacity for our patients. So we are actually renting inpatient capacity from other hospitals and paying them for that. This is meant to create a viable future for Ben Taub Hospital as one of only 2 level 1 trauma hospitals in Harris County. Farming out our ability to care for our patients is not addressing the future needs of this community. We need to look forward and try to create a viable solution for the future of Ben Taub Hospital. So what you're describing, sir, is already happening out of necessity. And I want to thank the rest of the hospitals in the Texas Medical Center who have worked diligently and collaboratively with us. A great example of that was during COVID, when the hospitals were actually doing a merry-go-round. We were all taking patients from each other because all the hospitals, y'all may not know this, every hospital in the Texas Medical Center is actually being challenged very similar to what we are. I won't mention name of our employee. Was it earlier? Yeah, earlier today or yesterday. Everything is coming together now. I was doing it was yesterday with the Houston Business Journal. And one of our employees, who is part of our communication staff, volunteered this information. I didn't know that his mother was at LBJ Hospital in our ICU. And he also shared that she is actually a Methodist patient. That when she needed to go to the hospital, the ambulance initially tried to go to the Methodist Hospital. Methodist Hospital said, "We're full." They tried to go to Memorial Hermann. Memorial Hermann said, "We're full." They tried to go to St. Luke's. St. Luke said, "We are full." They took her to LBJ Hospital because we will not turn anyone away. So I appreciate what you're saying. That is already happening, but that is not a solution to the issue, to the challenge we're trying to address.
Okay. My name is Patricia Casey. My question is relating to the nibbling of the Hermann Park. There are 3 tracks at issue here. There are 3 tracks at issue. You are planning to build on one of the tracks, and you want to nibble and take away all of the tracks with no plans other than to put in a wellness garden or possibly in the future to expand. But you know that the test is your plans have to be reasonable, they have to be prudent, they have to be feasible under the state law. You have no plans for anything that is feasible or prudent to take the rest of that property. You could cut the part that you need, you could tell the part that you need, you could do like pipelines do, they don't take the whole property, they take part of it. Why be so greedy here? Why not leave the rest of the park for the people of Houston, and you can still serve the people of Houston who you have the plans for the 100 beds to add? Thank you.
Thank you. So it's actually, I would take the opposite view of what you just said. The purpose of taking the entirety of the 8.9 acres has nothing to do with greed. It has to do with the fact that we not only are trying to create an expansion facility, we also have to be mindful of what we need into the future as far as the expansion of Ben Taub Hospital, but really important, and I kind of touched on that, but it's important to touch on it again. That piece of land is in a 100-year floodplain, just as the rest of Texas Medical Center Ben Taub Hospital is in the 500-year floodplain. So is most of Houston. We need that entirety of the land so that we can plan thoughtful, strategic design to not only allow for the expansion facility, but to put in what Louis was referring to, all the flood mitigation efforts that are necessary to ensure that we are protecting not only this expansion facility, but the current and the future Ben Taub Hospital, the Herman Park, the Houston Zoo, the golf course, and the rest of the Texas Medical Center hospitals. That is going to require space so that we can plan in a thoughtful, strategic way to create a foundation, not only for this expansion facility, but a future, bigger, more capable Ben Taub Hospital. So it really has nothing to do with greed, but I appreciate the question. Thank you for the question, ma'am.
All right, our next written question. So a couple of weeks ago, I saw on the news your strategic plan. It suggested that future facilities be built out in the community. Can you explain why you are not following your own strategic plan?
Yeah, thank you so much for that question. I had a sneaky suspicion that this question was going to come up. This is the slide that you guys are talking about. So a couple of Fridays ago, I won't mention any names. I won't mention what news channel. Everybody in this room knows who it was and what channel it was. They showed this slide and said, oh my God, Harris Health's strategic plan said that's where the hospital is supposed to go. What is Harris Health doing not following its own strategic plan? What was not shared with the audience, this is straight out of our strategic plan, and please don't take my word for it. Google Harris Health Strategic Plan 2021, go to page 20 and look at this map. What was not shared with the audience was the title of the map. Primary care needs of Harris County, not hospital needs of Harris County, not inpatient needs of Harris County, primary care needs of Harris County. Our strategic plan identified several areas of high needs in Harris County. And by high needs, I mean areas that have high concentration of indigent, uninsured, and underinsured residents of Harris County with little or no access to primary care services. The areas that were highlighted as the highest need was North Harris County, Northwest Harris County, Southwest Harris County. Guess where the clinics are going to go? North Harris County, Northwest Harris County, Southwest Harris County. Starting with Southwest Harris County, I'm really excited, and I'm probably breaking some rule here, but tomorrow at our board meeting, we're going to present the first location of the future clinics, which is going to be actually in this area, Southwest Harris County, which I'm very, very excited to announce tomorrow more fully exactly where it's going to be. But we are following our strategic plan 100% to the T, despite what the news media was trying to portray. So thank you for that question, whoever asked that question. Thank you.
All right, thank you, Dr. Porsa. Okay, the next question is, there are 3 entities that can claim and use eminent domain: state agencies, transportation, municipalities, infrastructure, utility districts, private entities with statutory designation from the state. Which of these entities does Harris Health fall under? I guess that's for our chief legal counsel.
Good evening, everyone. Now you can hear me. Thank you all for your time and attention to Harris Health's mission and for your engagement this evening. We appreciate all of you coming out and asking questions. The question at hand is, what kind of governmental entity is Harris Health? So Harris Health is a hospital district under Texas state law, and it is governed by Chapter 281 of the Health and Safety Code, and it is 100% government, and it does have powers with respect to eminent domain.
All right, thank you, Sarah. Anything you want to add? Okay. All right, anyone in the audience?
Thank you. Thank you. Is it working? It's on.
Hello? Hello? Regarding that map and the issue underlying that map, which is, does it make sense to build the new Ben Taub Level 1 Trauma Center blocks from Memorial Hermann's Level 1 Trauma Center? I want to quote from page 23, Harris Health 2021 to 2025 Strategic Plan. Quote, Ben Taub's proximity to Harris County's only other adult Level 1 trauma center indicates a need to consider a location that would provide greater geographic distribution of Level 1 trauma centers and promote more timely access to care in an emergency.
There wasn't a question in there, but I understand. I understand the gist of your comment. Y'all, I've said this before. Does it, in a alternate reality where Harris Health had a blank check and had all the money to build a hospital in every corner of Harris County? Absolutely. That would be ideal. And would it be ideal if there were enough doctors and nurses to staff all those hospitals? Absolutely. Would it be ideal if Harris Health had money to pay all those doctors and nurses to take care of all the patients in the different corners of Harris County? Absolutely. Unfortunately, there's also a reality. The reality is that we have $410 million toward the creation of an expansion facility for Ben Taub Hospital to address the emergent capacity issue need of Ben Taub Hospital. This land provides the only feasible, prudent option for creating that expansion facility. I would love to create additional Level 1 trauma hospitals all around the county. I can't. You already heard about the Level 1 trauma hospital that we are creating on the LBJ campus, which when it gets its designation probably by 2035, will become the third Level 1 trauma hospital in Harris County, the first one outside of the Texas Medical Center. But until and unless we actually have under the $2.5 billion to replace Ben Taub Hospital, this is the only viable, feasible, prudent option of using the taxpayers' money that has been trusted to us.
Thank you. Okay, so this one is. Was that two? Oh, we need one more. From the audience, anyone back here?
My name is Bennett, and first of all, I want to give you a compliment. I work with the constabulary here, and any police officer who gets shot or wounded, they want to go to Ben Taub until they get past the emergency stage, then they want to be transferred out. But my question is, this huge, humongous medical center, I haven't heard you say one thing about partnering with them. Why haven't you mentioned, well, they've suggested we do this, this, and this. They have all that land, all those resources. You're talking about the underground utilities, everything. They're experts at that. You have the old city health department sitting right across the street from that back door of yours. What's the plans for that? You know, there are a lot of things I haven't heard you talk about that need to be put on the table.
Thank you for that. First and foremost, before I forget, please, I encourage everybody to please go to our website, harrishealth.org. I know we're talking about a lot of issues and we're covering a lot of items. Everything that I'm telling you is already listed in our federal frequently asked questions in much more detail, including some of the options that we are not discussing, just like the one you just talked about, the city health tract. That city health tract is about 3.5 acres. and is way too distant from Ben Taub Hospital to allow it to attach to Ben Taub Hospital. It might as well be a mile away. It will not. Yeah, so thank you. So included in the plan? Okay. Y'all, just because we don't talk about some things, it doesn't mean that we're not considering them. Remember that the owner of this land and the owner of the tract that this gentleman is talking about is the city of Houston. So there is a lot of conversations happening currently between Harris Health and the city of Houston that I'm not at liberty to discussing, because these are being done among the legal teams. So again, just because we're not talking about certain things, it's not because we're not considering them, including what you just mentioned, but we cannot get into it. But I appreciate the shout out to our men and women of Ben Taub Hospital, because you're right. When anybody is a victim of a trauma, including gunshot wound, a fall, a car crash, things of that nature, they are brought to Ben Taub Hospital for good reason. Thank you for that.
Okay, so this is, oh, go ahead, Nicholas.
Hello. Oh, there we go. Just a little bit, because you touched a little bit on the Texas Medical Center, but it kind of connects to an earlier question related to the other health systems in Harris County, et cetera, related to relationships. And you've heard some responses about, we actually do work with them. When we had the slide up of all of the letters of support, a lot of it has been from the...
Hold it. Your history has been bad with the medical center. They didn't want Ben Taub there. They put a fence up. You still have the alley, that's
Well,
the driveway. Now, let me finish.
Okay.
They put a fence up. They didn't want you to be part of the medical center. So my question is, what have you done to better create a partnership? They have humongous resources. MHMRA, or whatever they call that place right behind you, it's teetering on the verge of evaporation. Okay? So you need to look at all those things right there in your vicinity.
Well, and we do. We actually have a very strong and robust relationship with the Texas Medical Center and the other organizations. You'll see that we have letters of support from all of those organizations. But to be clear, Harris County was very foresighted in creating a hospital district to care for its indigent population. Because what we know in areas that do not have that type of concentrated care, the care is simply subpar for a large part of the population. As you've seen on some of the information we've provided, we are a funded organization by Harris County related to serving all residents, but specifically indigent population as well, and we do so at the highest standards of any health system in Harris County. That is a real testament to our commitment to the care of individuals in this county, regardless of their background or any other conditions related to that. The other health systems relate to us in that perspective, and they support us related to that mission related to what we're doing, but they do expect us to carry the mission out because we do get funding. A third of our funding comes from property tax in Harris County related to that. We carry that in a very high regard related to how we are a steward of that. The other health systems care they are providing related to that. We are the concentrated care provider for people who do not have resources in Harris County, and that is how it has been structured for 60 years.
Absolutely. Thank you, Louis. So this next question is a little bit about the footprint, the usable footprint of the current Ben Taub. So why can't you just expand into the front lawn of Ben Taub, or the log cabin for that matter?
It's okay, I'll do it again. So the log cabin, I'm not sure how many people know about the log cabin. There's a log cabin in front of Ben Taub Hospital. I always forget, the Daughters of Texas Republic?
The Daughters of the Texas Revolution, right? No. There we go.
Sorry. The Daughters of the Republic of Texas. It sits on a kind of a triangular piece of land in front of Ben Taub Hospital. It's totally about 1.5 acres. You're all trying to fit a building and a piece of land that is too small to allow for that expansion facility to operate efficiently and according to the modern hospital codes, it would be an exercise in futility. Can we build something on it? Yeah, but is it going to actually be functional? No. Are we going to be throwing away $400 million of taxpayers' money? Yeah. The goal is not to spend $400 million. The goal is to invest $400 million toward the creation of an expansion facility that makes sense, that is the most feasible and most prudent use of that money, but also really, really important, you all. This is the opportunity that really excites me, is that we can actually use this as the first stage, the foundation of a future, bigger, more capable Ben Taub Hospital. We have a great opportunity in front of us to do this. And again, I really hope and I pray that we're wise enough to take advantage of this opportunity.
Well, and I'd like to just piggyback on that just for a moment, because it goes to an earlier question about the use of all the land. The thing that Harris County and Harris Health is suffering from today is a lack of options and flexibility. We have no options. LBJ had some options because we had property there we could work with. But the facility at LBJ was not built to expand, to do anything, build on top. It was just what it was. And so what we are having to do now is build a whole new inpatient facility at $2 billion in order to address what is the needs. Ben Taub is similarly related to that. And so what we're trying to do at this point in our history is not just plug the finger in the dike, which was done many, many years ago, but we're trying to create options for a future generation so they are not facing this issue and that they have options. When we're building LBJ Hospital today, LBJ Hospital will be built with 390 beds. It will open with 330. It's capable of building out to 450 and an expansion tower to 600. It has options for the future that generation can decide how to use it, but they will have options. Ben Taub Hospital, the expansion facility, will be able to go up. It will be able to go out. It will have options related to thoughtful ability to serve not only today, but literally 40 and 50 years from now, so that it's not in this type of a situation. So it's about addressing our issues today, but what we have chosen to do physically as well as technologically, and there's all kind of other things we're doing at Harris Health, is to build an organization that is resilient and capable of functioning 50 years from now versus just in the next 10 years. So we're trying to gift the future. That is what we're trying to do. Now, are there total certainties that there's going to be another bond 20, 25 years from now and where that's going to go? No, we can't. We can't have that prediction ability. We can't actually take actions today that hamstrings a future Harris County Commissioner's Court or the Board of Harris Health. But what we can do is create a path and options and flexibility so that people in this county will not lose the level of care that Harris Health provides, because that's what we're on the thread of doing. LBJ Hospital, some of you may remember the news, 2019, we almost had to shut the hospital down because it was literally falling apart. We were able to salvage it and keep it functioning and get us to this point, but it's still limping along. It is by no means any kind of really operating at its full capability. Ben Taub is on the same path. It's just a little behind LBJ. We're trying to make sure that we're gifting the current, but also the future. And that's an important element of this strategy about what we're trying to do in this day and time, looking ahead into the future, because that's what Harris County is really known for. How do we really plan? Look at Herman Park, right? I mean, it is a testament to that investment. We're trying to do the same thing with public health care, which is, we believe, very essential to the health of Harris County.
Your words are very troubling because, to echo Ms. Caudill's description of nibbling, to quote a very child book, when you give a mouse a cookie, he's going to ask for a glass of milk. What comes next with you?
Ma'am,
because you have not foreseen more. And where are we going to take that?
Right now, with our design options that we have done, everything could be placed on that property for a future 600-bed Ben Taub. So it can accommodate the construction. We can accommodate the water retention, knowing what we know today. And so we do believe it is a gift into the future about having a path to address the issue so that we're not in this same conversation then. We actually do have that ability to say, yes, this property, 8.9 acres, can accommodate what would be necessary. If we had $2.5 billion today, that's what we'd be building.
I just want to take a moment. We are here to answer questions. So that's what we're trying to do. So we want to accommodate everybody's question, and we want to get to that. So we will come back to the audience. But our second written question.
I didn't get my question answered on whether or not a coalition has been put together to get the hospital systems together. I got that, but I didn't get an answer to my question. I didn't get an answer to mine. You said you get an answer questions. I did not get an answer to my question on whether or not TMO has.
We are responding to each comment and question as they're presented. So we're going to continue on.
I didn't get an answer to mine, so I'm waiting for it.
Your turn will come back up.
All right, thank you. I'll be waiting for it.
So in our second written question, what is a ballpark market value currently for the proposed park property? You must have a generalized value in your mind.
Do I have a generalized value in my mind? Yes. Am I willing to share it with this audience? No. Like I said, oh, okay, go ahead.
Sure, yes. And Harris Health will not be answering that question for this audience. The fair market value of that land will be a determination made by a special commissioner's court. And because that topic will be a subject of litigation, administration will not be commenting on that topic. Thank you for your question.
Let me get back to that question about the coalition. I'm not sure exactly there's going to be a coalition or a commission, but I can tell you that we are in partnership and collaboration with all Texas Medical Center hospitals. And they continue to help. They have helped. They continue to help. And they will continue to help and be part of the solution. Y'all, I'm going to quote Dr. David Pearce, the Chief Medical Officer for the Houston Fire Department. And I think he actually said it best. He said, Harris Health is never going to be large enough. It's not going to have enough hospitals. It's not going to have enough clinics to address the needs of Harris County, period. We are a county of 5 million people when 1.2 million people have no health insurance, the highest number and percentage of uninsured in the country. So what we are creating is, yes, additional capacity to Ben Taub Hospital to get us enough space into the future so that we can actually come up with a bigger, better Ben Taub Hospital. Is that going to be enough to meet the needs of the indigent of this county? No, it is not. That is why the rest of the Texas Medical Center hospitals are also doing their part in taking care of the indigent of Harris County. We take care of a disproportionate share of the indigent in Harris County. That is our mission. That's why Harris Health exists. But please understand, and this is the reality, Memorial Hermann takes care of indigent patients, Methodist Hospital takes care of indigent patients, St. Luke's Hospital takes care of indigent patients, HCA hospitals take care of indigent patients. It is only through that collaboration that we are able to provide the services to the entire community. Please don't make a mistake about this. Other hospitals are partnering with Harris Health. It is only through that partnership and collaboration that we are able to stand here today and be proud of the level of health services that are being provided in this community.
Okay, question from the audience up here.
Thank you. I'm a Dolphin Square with Houston Homeless Hotel. All right, thank you. You want to hold it? I feel like I'm on more. I'm a Dolphin Square with Houston Homeless Hotel, and I'd like to give thanks to God that I came here today. I wasn't coming, but years ago, I was homeless, And now I have a business that helps the homeless. I didn't have anywhere to go, nowhere. I had a punctured rib. And if you never had a punctured rib, you don't want one. It happens, and I just coughed or sneezed. I didn't know you could break a rib from sneezing, but I must have sneezed pretty hard. Anyway, I came to Ben Taub years ago. This was about 2009. And even though it took a minute for them to see me, I wasn't leaving because I didn't know what was going on. I didn't know if I was dying or whatever. But what I'm trying to say here is the homeless, we got a backlog of people that need help because we need the funding and all that, but they're coming here more and more, and they're going to need health care. The thing is, we see it every day. We're just talking about the people in Houston, but we see people coming from Washington, Chicago, name a state. They're coming, and you can't stop them. They're U.S. citizens.
Sir, is there a question you're getting to?
Yeah, that was my statement. My question is, how long will this project take?
Thank you for that, and I appreciate the shout out. And I'm really happy about the turn of events for you, going from homeless to having actually business helping the homeless. And I always, it is actually, I should be ashamed of this. When I talk about the services that Harris Health provides, I always leave out our healthcare for the homeless program, which is actually one of the largest in the country. We have, I don't know how many clinics inside the homeless shelters taking care of the homeless. But anyways, getting back to your question, it's kind of a challenging question, but I'll try to do my best. Let's assume everything goes well, all right? I go back to the Commissioner's Court at the end of this month. They say, great job. Let's set a date for the public hearing. We go back on March 19th. They get, okay, you got our vote. You can proceed with the eminent domain. And it's going to take at least a couple of months, like Ms. Thomas, Sarah, our Chief Legal Officer, said the fair market value will have to be assigned by a court. It's not going to be me. It's not going to be Herman Park Conservancy or the city or the county. It's going to be a court deciding that. I'm assuming that's going to take at least a couple of months for that to happen. When that happens, whatever that fair market value is, it is at that point that Harris Health is going to have to deposit that amount into an escrow account. At that point, Harris Health can actually take legal ownership of the land because they have purchased it. Does that mean that the legal issues are over? No. Everybody anticipates that the legal matter is going to continue for years. People are going to be suing each other for who gets what money. That has nothing to do with Harris Health. Harris Health does not make that decision. The courts make that decision. But let's say everything goes well, we take ownership of the land, end of summer this year, we can actually issue an RFP and engage a design firm and an architectural firm and have a design about a year from this summer. We could potentially, God willing, everything going well, break ground at the end of next year, 2027. And once that happens, I'm going to look at Lewis because I always pressure him about once we start a project, when is it going to finish? So assuming we're going to break ground at the end of 2027, when can you open the doors to the expansion facility? Assuming we're going to break ground at the end of 2027.
So making all those assumptions, and I hope that's on the, we got all those assumptions.
It's assumptions.
Captured, yeah. It'd be 2031, thereabouts, related, that we would be able to bring that online related to serving Ben Taub Hospital.
Did I answer your question?
Yeah. Thank you. All right, another question.
My question is, we are at this point, there's no question about the service that you provide. It's stellar, it's world class. But we're at this point because somebody didn't plan 25 or 30 years ago. And I'm not hearing anything. You're saying that it's going to have expansion capacity, but how far out in the future is that capacity going to extend? Because I don't want to be here in 25 or 30 years. Oh, we're landlocked, so we're going to have to take more of Herman Park.
Yeah, no, the expansion facility would be a portion of the property that we're talking about. The remainder of the property would be the completion of the replacement of Ben Taub Hospital at that point in time. Now, the issue becomes finances. Harris Health is an organization just like you personally, right? You have a credit score, you have so much debt capacity. When we went to the voters in the fall of '23 and got overwhelming support to have the bond referendum for $2.5 billion, that number came from the fact that that is the maximum amount Harris Health can borrow. It wasn't all that we needed, it was what we could borrow. So we have to pay that mortgage down in order to take on another mortgage. We believe paying down that mortgage is 20 to 25 years out to then go to the voters for another bond referendum to then get another $2.5 billion, so to speak, that would then replace Ben Taub Hospital on the remainder of the property that the expansion facility would tie into and would enable the further expansion and the ability to totally replace the Ben Taub Hospital that exists today. And at that point, Ben Taub Hospital is not capable of being sustained. And we're going to be having to spend a lot of money between now and then just to keep it functional, more so than you would normally do to a healthcare facility. But those are the options that are in front of us.
Okay, so you have gotten $401 million, but you're talking truthfully that it is $2+ billion to build it. Where's that money coming from?
It's going to come from another bond referendum.
Okay, so we're starting this process, but what if the voters said, no, sorry guys, we're not going to do it? What happens then?
Well, that is possible. Just like Commissioner's Court could say no on the eminent domain. And at that point in time, I would just tell you, right, that there's some very significant choices that Harris County is going to make because Ben Taub will not be sustainable in that period of time. So, because it should have been replaced several years ago, and that's, the can keeps getting kicked down the road. We're trying to take responsibility and say, not on our watch. We're going to try to do and give options into the future, as I've said, and I'm trying to be very genuine about that. We're really, because I tell you, it'd be easy to kick the can down the road and say, fine, we'll just put something, slap it together, put it up, do this, let somebody else figure this out long term. We're trying to really say, no, it is our responsibility, our stewardship, that we actually solve the problem today.
What assurance do we have that you won't do another land grab at some point in the future?
Yeah, we cannot obligate a future, board, or the Commissioner's Court cannot do that. We believe, though, that by providing a very legitimate path related to how a problem could be solved in the future will prevent that from happening. But that is as much as we are able to do at this point, given what we have the responsibilities for. Nothing's perfect in this world. We're trying to give it as much of an option. Because why are we here today? Because the past did not create any kind of path where we're up here trying to defend while we're not building on the property we have because we want to do a left turn on the property instead of a right turn on the dog leg, right? We can't even defend anything because nothing exists. The future generation would have to defend, why are you not building on the property that exists?
Sarah, was there something you wanted to add?
No.
No. Okay, well, let's move on to the next written question. What flood mitigation efforts are you planning? The land you want to acquire is in the 100-year floodplain. How are you going to prevent flooding of the new building and surrounding area?
So, now, we don't own the property, so we're still working through a lot of the design and understanding. What we know is that, generally speaking, you've got to deal with water retention on that property, and you can do that with some surface rendering of how the property, you create swells and things of that nature, but you also can put underground retention. At LBJ, we were facing the same thing. LBJ campus is sitting on the current map today in the 100-year floodplain. So we have put 8.5 million gallons of water retention underneath the entire campus and construction of the new that we are putting up there. That far exceeds any kind of requirement. But we know the weather events are going to get worse, right? So we believe so. So we're trying, again, give paths and options to the future. So we have elevated LBJ or the inpatient facility on the campus up higher than the existing hospital. We have created the underground retention underneath the entire site that is under construction at LBJ. We have also created basement spaces of the LBJ building that can flood without permeating into the facility for a total of 8.5 million gallons of retention that does not exist there today or before we started construction. That whole area is going to dramatically be different related to heavy rain events and flooding, coupled with what Harris County has invested in all of their own mitigations of the bayous, et cetera, like that. They have improved dramatically how even the 100 and 500-year floodplains are actually mapped under the FEMA maps related to that. We would take that experience and apply it to this property for underground retention, surface retention, elevating the facility, creating areas of the building, a basement and the first floor that could actually flood without impacting the clinical services of the hospital. That is a known element today. It can be designed to that, and that's part of the efforts we would take from a water mitigation standpoint.
Dr. Porsa mentioned earlier that healthcare is one of the most regulated industries that exist, and he's correct. So along with nuclear power, aviation, healthcare is on top of the list as far as regulated industries. So as part of this process, we will have to work with hospital licensing authorities to ensure that our vulnerable populations are kept safe and that any expansion facility or future hospital that is built complies with all laws and codes with respect to hospital licensing. In addition to that, we will be working with the city, the county, and Harris County Flood Control and all other appropriate governmental authorities to ensure that whatever solutions are put into place are legally sound and safe for future.
Okay. Our next written question, how much more would it cost to build on top of the existing building? How would building on top of the existing structure affect operation of Ben Taub while you are under construction?
I'll answer that again.
Are we in agreement to move on to the next one? Okay. All right, next question. Could you please explain again how Harris Health has considered all options for creating the expansion facility?
It's kind of like the same question as before, but I'll give it a try again. And again, I encourage everybody to please go to harrishealth.org because this issue has been clearly put into a table of all the different options that we have considered and how we have systematically reviewed it and decided that there are not good options other than the option in front of us. Again, just to quickly go over the different options, we cannot build on top of the hospital because it was not designed as such. We cannot build on the current footprint of Ben Taub Hospital because there's not enough space to allow for the creation of an operationally feasible, prudent expansion facility to be created. We cannot build in a geographically distant location to Ben Taub Hospital because we do not have the funding for creating another hospital. That's what it was going to take. So using the land that is immediately adjacent to Ben Taub Hospital, allowing this expansion facility to be connected to Ben Taub Hospital is the only viable, prudent, feasible option of the use of the funding that is available to us, the $410 million of the bond funds.
Moving back into the audience, if there are any questions. Did I see somebody in the back? Yes, ma'am?
My name is Angela Obasi. I'm from this area. The problem I'm having with this is City of Houston is inside Harris County. Can they donate this property instead of asking for that money? Use that money to make sure that you upgrade the things you need.
The question was, couldn't they donate the property?
Donate this property.
Sarah's got it.
Okay, so I think the question was, can the city of Houston donate the land? I would love that, but we'll hear Sarah's comment. Thank you for that.
Yeah,
Thank you. Yes, ma'am.
we would all love that. And honestly, everyone, if we could just purchase this land, we would have just purchased the land. As many of you may know, this land has reversionary interests. That means that there are heirs who also have ownership interests with respect to this land. And so Harris Health is utilizing the legal tool of eminent domain to pay not only the city of Houston, but also the heirs who have reversionary interest rights to this land. So we are not able to purchase it, unfortunately.
Or having it donated to us, unfortunately.
Another audience question?
Or comment?
I just got a quick question.
Oh, there's somebody else.
With the new facility.
We'll come back to you.
Okay, I was understanding that you have 80,000 emergency calls a year. Where are all these emergency calls going? Are they all going to Ben Taub annually? And who are they?
Yeah.
Is it nationwide or just within Harris County or in Texas, or who are all these people?
Yes, no, thank you for that. So now this is annually to Ben Taub Hospital, and these are all from Harris County. These are all Harris County residents. Yes, sir. Harris. No, sir. No, these are. So Ben Taub Hospital, as a level 1 trauma hospital, is a very, very busy emergency room. So 80,000 ER visits is actually at Ben Taub. Yes, sir. No, sir. And thank you for pointing that out, because that deserves to be said. Just to. Well, these are all Harris County residents. But what I wanted to say is that they are Harris County residents, sir. Ben Taub Hospital has 402 licensed beds. LBJ has 211 licensed beds. Ben Taub Hospital sees 80,000 ER visits a year. LBJ Hospital sees 80,000 ER visits a year. Y'all, our hospitals are busy. That's what makes LBJ Hospital the busiest level 3 trauma hospital in the country. They are all Harris County residents.
All right, let's move to the next written question.
Was that two?
Yes. How does it make sense to build a new Ben Taub blocks from Memorial Hermann, two Trauma One Center hospitals blocks apart from each other, when your own strategic plan 2021-25 states a location that would provide greater geographic distribution?
I think this was also a question that was already answered. And again, not having any funding restriction, I would love to create not 1, not 2, but 4 additional hospitals in the different corners of Harris County. Unfortunately, that is not reality. We do not have the funding for that. What we do have available to us is $400 million toward the expansion of Ben Taub Hospital, which is what we promised our Harris County residents when they approved our bond proposal. That is what is available to us. That is what we are proceeding with. That's what this proposal is, and that's what we plan to do for the expansion facility. Again, do I wish I could build another hospital somewhere else? Absolutely. We're short of another $2.5 billion funding for it. We cannot do that.
Okay, so this next.
Well, hang on. I would like just to piggyback on that, because we keep kind of framing this about the funding it takes to build another hospital, which is a lot, because again, the codes, the requirements of a healthcare facility are extremely high. But there is also a lot of money it takes to operate these facilities. Ben Taub Hospital takes over $500 million a year to operate. There is not enough taxpayer support to duplicate that for Harris Health in any kind of meaningful way other than what we are doing today. So when we say go build another hospital, et cetera, you're talking about hundreds of millions of dollars year in and year out that has to be available. And that just does not exist for Harris Health. We're using the funding we have to the best we know related to our facilities, expanding where we can. We're investing in the LBJ. We're trying to get expansion on Ben Taub, but we're trying to leverage some of those investments and resources that exist, because developing an entirely new hospital, there's just not the ongoing annual capability. We are not a health system like a Memorial Hermann Methodist, St. Luke's, et cetera, that gets a lot of commercial business and really is able to leverage where they put their facilities. We are in areas that don't have that level of support by intention, right? We are the safety net system in Harris County. So we're in areas you don't see the other health systems, and there's a reason for that. And we take that very seriously related to that, but there's only so much we're funded and being able to do that related to not only building facilities, but operating them in a way that we are in a sustainable method. So there's both sides of that coin that is a real challenge for organizations, regardless of your funding.
So this next question is kind of a variation of something that we've already addressed, so I'm going to leave it up to the group to decide if you want to hear this or move on. You say you have $400 million to spend from the bond. What is the estimated cost to purchase the land and build the expansion building? I think you've already kind of addressed that. Are y'all comfortable with moving on? Okay.
You can't give us a number, we understand, fine, move on.
All right.
What happens if the estimate comes in greater than that 400 million? Is there a backup plan for that? They have to go back for another bond.
Can we come back to that when we open back up to the audience? Okay. Ben Taub already lacks enough parking. How will people be able to find parking with the additional 100 beds and additional staff?
Yeah, it is going to be difficult. And that's one of the reasons why knocking down the existing Ben Taub garage is not an option. So what we are not discussing here, y'all, is looking into our plans and allowing for additional parking. Let me put it this way. Is additional parking one of the things that we are seriously considering for the future of that area? Absolutely, because we have to. Because whoever asked this question is right. As I've already mentioned, we don't have enough space today for our patients, our employees, to park at the Ben Taub garage. It would really behoove us not to be renting parking spaces from the TMC into the future. So at some point in the future, there will be additional parking spaces and garages in that area, not to get into the details of exactly where that may go, but that has to be additional parking, not just to address our issue, Harris Health's need for parking, but as said on one of the slides, one of our commitments is actually to become part of the solution for the chronic parking challenge that Hermann Park, that the Houston Zoo, and the golf course are currently facing. We want to be actually partnering with them to address those challenges as well, not just for us, but for them as well.
All right, back in the audience, I think there was a gentleman back here, and then we wanted to get back to your question.
Jerry Damon. What about staffing of the new hospital? I'm sure there's a lot of competition among all the Texas Medical Center hospitals for staffing, doctors and nurses and other staff. And I've also been reading there's a big doctor nursing shortage across the country. I'm assuming that's going to be a challenge as well.
Yeah, thank you for that question. Yeah, absolutely. There's a doctor shortage, there's a nursing shortage, and we are in the Texas Medical Center, the largest medical center in the world. So how is it that Harris Health is able to manage? How is it that we are even able to manage today? And you all may not believe this, but we actually have the lowest turnover, highest retention rate of any hospital in this region. Our retention, yeah, thank you, we have a nurse here. So our retention rate is actually better than the region, the state, and national level. Why is that? It's not because we have glamorous hospitals. It's not because our clinics have this and that. It's not because we have chandeliers in our waiting rooms. No. People of Harris Health work at Harris Health because this is the calling for them. They do it because they love doing what they do. So to get into, thank you. To get more into the detail of your question, because this is all fine and dandy, but yes, we're going to create this additional capacity. For goodness sake, we're building a brand new hospital on the LBJ campus that is twice the size of the existing LBJ hospital. So how is it that we are going to address this? We started planning for that additional staffing actually a few years ago. So one of the things that I'm really proud of, and I'm so glad I have the opportunity to say this, because I think it's just such innovative. We started tapping into some of the high schools around LBJ Hospital, 3rd Ward and 5th Ward. Why is that? Because we believe that if we can get our future employees from those areas, chances are they're going to want to stay in that area. So what we are doing is that we are in partnership with our high schools around that area. We have recruited recently graduated high school students who are not planning to go to college. They are entering either our culinary program or environmental services. Not that we want them to become cooks or clean the floors for the rest of their lives, but to get them into the doors. Because once they become Harris Health employees, Harris Health actually pays for the tuition and fees to go to nursing school. We are growing our own nurses, y'all. I am so proud of that fact. Now, as far as the doctors, we can't grow our own doctors, but we can grow our other providers, PAs, and nurse practitioners, which is what we're doing. But also in partnership with, again, McGovern Medical School, Baylor College of Medicine, our newest medical school, University of Houston Medical School, they are actually gradually increasing the size of their schools, knowing that we need that additional workforce into the future. So great question. And I'm just so happy that we've actually been looking into the future, getting ready for the time that is going to come. In 2029, when the new hospital on the LBJ campus opens, we're going to need a lot more doctors and nurses and techs and everything else. And we're geared up for that. So thank you for that question.
Ma'am, you had a follow-up question for me?
Yes, you talked about the $410 for the expansion.
More than 10 million.
Sorry, slip of the tongue. But with rising costs that we all see everywhere, including construction costs, and best case scenario is that this wouldn't even start until the end of 2027. Is there a contingency? What happens if there isn't enough money to do what, you don't even have, you said you would contact the architectural firms and start firming up the specific plans. What happens if costs go over and y'all need more than the 410 million?
So, first of all, yes, a lot of things can happen, right? I will tell you that number actually has a built-in escalation that we're projecting about what costs could be. So we're trying to adjust for that of what could be, right, related to this. But at any given moment, right, I mean, there can be tariffs, there could be all kind of things, right, that can impact what we're trying to do. What we're left to do is how do we still stay true to the projects and addressing our facility issues as best we can within the time frames we have, right? In the original projections of how we would use the funding, we talked about 10-year time frames related to addressing the ambulatory needs, the acute needs at both of our hospitals, et cetera. Does that go to 12? Does that go to 13 years? It could. At the end of the day, we believe we have a path related to everything we've talked about. Taking into consideration the escalation, we think we've seen a significant part of that construction escalation that we have absorbed up to this point in time related to the projects, but we don't have a crystal ball. So we will have to adjust to budgets that we would set at the time we kick off projects and get as far down that road as we possibly can. And that's just as honest of an answer as I can give.
Yeah, let me thank you for that question first and foremost. And Louis is being a little humble here, and I'm going to gloat on him a little bit. If you all go back to that strategic plan or strategic facilities plan and the bond proposal was $2.5 billion. Not that we needed $2.5 billion, we needed $5 billion. But our borrowing capacity was $2.5 billion. When we look at the overall 10-year master facilities plan, when we're talking about the creation of the new hospital on the LBJ campus, refurbishing of the LBJ, expansion of Ben Taub, $500 million, expansion of primary care services in our community health centers, creation of an urgent care clinics, which I'm very excited about. When you add all those things up, that was $3.2 billion, not $2.5 billion. There was a $700 million gap. I'm saying this to get to your question about, what do you do when there's such a large gap? So we, Harris Health, committed ourselves to fill that gap, and Beth Robertson left. She is actually, it was during that time when she stepped forward and said, I want to volunteer to create this new foundation for Harris Health. They promised to raise $100 million over the next 10 years to fill some of that gap. There was $300 million promised in terms of operational cost savings. Yes, we actually said that over the next 10 years, even though we're going to do more, we are going to actually save $300 million toward this, and $300 million of routine capital expenditure to fill that gap. Y'all are gonna know this because I can't hide it. On January 23rd, a couple of weeks from now, we're going to celebrate the 60th anniversary of Harris Health. During that celebration, we're also going to make a huge announcement about the status of that fundraising. I have been sworn to secrecy of not tell you what that news is, but it is extremely exciting, and I invite you all to stay tuned for January 23rd, that afternoon, when we make this announcement. So absolutely, as the cost is going to vary, go up and down, hopefully down, it will never happen. Is it going to go up? Yes, we anticipate that, and we're planning for it.
Moving to the next written question. It has been brought to your attention that building a new hospital in a designated 100-year floodplain is against the law. The 8.9 acres you propose to seize is in such a floodplain. How has this information changed your thinking?
I don't know which law is being referenced as far as building in a 100-year floodplain is against the law, but it is not our understanding that there is anything against the law. I think we previously mentioned hospitals are highly regulated, and we work with licensing authorities, including licensing authorities under the Texas Administrative Code, and so we are continuing to work with all necessary regulators, licensing authorities, and state and city officials to ensure that whatever we do is above board and in compliance with all necessary regulations.
Absolutely, and those permits are available.
All right, and our next written question, why does not Ben Taub imitate other TMC hospitals, acknowledge lack of land to expand in TMC, and build satellite facilities around the edges of the city where land is cheaper, patients are poorer, and lacking in insurance and transportation? Those are the patients who need faster access to medical help.
Yeah, I think we've covered in great details about, why can't we build a hospital somewhere else, even though I wish we could. But this gives me the opportunity to talk about the other part of our strategic plan that we really don't focus on just because we were talking about Ben Taub. Remember what I said about the promise to invest $500 million toward the expansion of our primary care clinics. Y'all, this is the first time Harris Health has ever invested this amount of money into our community health centers. Why is that? It's exactly getting to the question that was posed. We want to go to our patients. We want to go to our communities for a couple of reasons. One, to prevent them from having to come to our emergency rooms. I mentioned that we are creating urgent care centers with expanded operating hours from 8 a.m. to 8 p.m. 7 days a week. A couple of weeks ago, we opened our second one. When this is all said and done, we're going to have 5 of them across the Harris County for exactly that reason. Because the patients that we serve, the patients that we are proud to serve, the indigent, the uninsured, the underinsured, are also the same patients who struggle with transportation. So we are trying to address that through the expansion of those facilities. In addition to that, we are also doing, again, getting outside of a brick and mortar. We have significantly increased our virtual care capacity. Last year, we had close to 500,000 virtual care encounters. In 2020, when I first joined Harris Health, in March of 2020, Harris Health had 4 virtual care encounters. So we have tremendously increased our ability to provide services virtually to address this issue. In addition to that, and this is something else that I'm really proud of, Harris Health today is the only hospital system in Houston that provides hospital at home program. We are taking care of our patients who are acutely ill to the point that need to be in the hospital. We are able to care for them at their homes. We send doctors, nurses, pharmacists, technicians, radiologists. We send them to people's homes to take care of them. We started that program 2 years ago, and that program is rapidly expanding. Every patient that we take care of at home is one additional hospital bed that is being freed up so that we can use. Harris Health today is the only hospital in Houston, Texas, that is providing this program. This is an all-out effort trying to address the issue. So it's not just expansion of Ben Taub. It is not just building another hospital on the LBJ campus. It is not just creation of new clinics or adding capabilities. It is not just the urgent care. It is not just the virtual care. It is not just the hospital at home. It is all of it that is meant to address the patient challenge that we have today. The 1.2 million people who are uninsured in this county who need our help, because without us, they would have no access to health care.
So we've got about 5 minutes left here tonight. Are there any additional questions from the audience? Go ahead.
I just have a quick one. How do you let people know about your clinics and everything you do in neighborhoods? How do you let them know? How do they find out about it?
Yeah, thank you. So through this, obviously we can't do this every day, everywhere. Again, I encourage everybody to please go harrishealth.org. You know, just like everything else that is different from Harris Health to other hospitals in this area, like I said at the beginning, you know, everybody sees all these ads everywhere, right? You know, on the highways, in the airport, on TV. We do not have funding for that type of advertisement. We do a little bit of it to get our name out there, especially during the bond proposal, but unfortunately we do not have funding for that as a tax-supported entity. We just don't. So we rely on social media, we rely on the word of mouth. Yesterday I was talking to somebody else about our patient financial assistance, providing low-cost or no-cost care to the residents of Harris County who are below 150 federal poverty level. There are many residents of Harris County who could tap into that resource and don't, because they don't know about us. Even today, they don't know about the services that are available through Harris Health. I'm going to say one more thing. I'm sorry, because it just came to my mind and I have to gloat about this as well. And that goes along the way that what we just talked about, the urgent cares and everything else. Harris Health, several years ago, almost 6 years ago now, this is something I'm really proud of. We are paying for the health insurance premiums of somewhere between, and this number oscillates up and down, between 15,000 to 20,000 Harris County residents. These are Harris County residents that we, Harris Health, are paying for the healthcare insurance premiums, giving them access to private health insurance. Now, they can't all come to us because we just don't have the capacity. So they go to Memorial Hermann and Methodist and HCA and St. Luke's. Two things happen. One, we achieve our mission of providing health care to these patients. Two, other hospitals, including us, now have access to billing private health insurance companies. So it's actually becomes a source of revenue for us, for other hospitals in this community, not to mention providing access to private health insurance to about 20,000 Harris County residents. I think we're about time. Before I leave, I want to say something. I think this is really important. This is something I shared this morning. And that's the purpose of these town halls. And I want to be very clear. These town halls are not meant to sway anyone. They are not meant to change anybody's mind or anybody's heart. I am very sensitive and cognizant and respectful of those in our community who have strong convictions and emotions towards protecting our parklands. I get it. I honor it. I do not want to discount it. This is not about changing those ideas. This is about informing you and educating you and allowing for a two-way conversation so we can better understand the needs of each other. Something that I shared this morning is that recently I read a book about changing your question, changing your life. And it has to do with the way we look at issues. If we look at this matter as a zero-sum game, loss for public parks, gain for public health, it's going to become a challenging conversation. But what I would like to challenge all of us in this room and in the community is to reformat that question. What if we ask the question, knowing what the challenge is, can we work together, think thoughtfully and strategically to create a win-win situation, like Commissioner Briones said at the beginning, so that we can increase access to public parks, but also increase access to public health. With that said, I want to thank you all again for being here tonight. Thank you for your participation. Thank you for the questions. Really appreciate all of you. Thank you.